The number of whooping cough cases in several provinces continues to rise, and that is prompting warnings from doctors. CTV's medical expert, Dr. Marla Shapiro, is here with me now to talk more about it. Dr. Shapiro, thank you as always for joining us. What is the situation like? How bad is it?
It's really quite, you take a look at the numbers and you really take a step back. There's a normal cyclicity to whooping cough, bordetella pertussis, which is what we call it, usually about 2 to 5 years. 2019, we saw a peak. 5 years later, we're seeing a peak, but it's probably being fueled not only by the normal cyclicity that we see of it, but the fact that so many kids fell off their vaccines. So if we look at the numbers, look at Quebec, 11,600, compared to just, normally an annual basis is 500 to 600. You look at Ontario, 470. Normally our cases are in the double digits. New Brunswick as well, 141 cases. So if you look at what the baseline has been for the past several years and where we are now, those numbers are really up, not only in Canada, we're seeing them in North America, the United States as well. So we're really concerned. We're on the moment of kids going back to school, and it's transmitted airborne. So it's really concerning about these rise in these numbers.
And it's easily transmittable,
Easily.
but it's also easily taken care of too. Vaccination.
It is.
Right?
when you look at sort of who's at risk, anybody who's very young or has any type of autoimmune condition, asthma, that type of thing, we typically see in 10 to 14-year-olds, there's a number of cases, but we're really worried about the kids under age 1. And our vaccine schedule is really quite clear. We start immunizing at 2 months, 4 months, 6 months, when a child is 18 months of age, again at age 4 to 6, again at age 15. So there's that big gap between 4 and then 15, which is why you see a lot of kids between 10 to 14 running out of that immunity. And then once as an adult. And for pregnant moms, we vaccinate them in their last trimester so that they'll develop antibodies and pass it on to the baby so they're protected before they have their first series, which doesn't start until 2 months. So you can see that if, we lose the vaccines and we lose the herd immunity, we get that increase in transmission. And it really is a worrisome disease.
What's the concern with it? What makes it so dangerous?
First of all, the symptoms are really no fun. Lots of coughing, runny nose. The cough can last up to 100 days. It's got that classic sort of whoop noise that comes after the coughing. And, you really can be quite ill. And we even see mortality with this, particularly in the very young. So that's the concern that we have with this. If we don't diagnose you and treat you with an antibiotic within the first few weeks, antibiotics probably won't help, and then it's a question of running the course. If you know that you've been exposed to a case, we can give you post-exposure antibiotics, but really the number one is vaccination. Vaccination, this is a vaccine-preventable disease. Good hygiene is important, but this is airborne, and you really want to diagnose early, treat early, but really this is about prevention. So look at the age of your children. Did they, run out of their vaccines during COVID, and are they not up to date? As an adult, have you had your pertussis vaccine? And as a pregnant mom, remember, you must be vaccinated in that last trimester.
And it makes me want to check on it because I know my son, he's got all his vaccines, but because he was 15 through the tail end of the pandemic, so I'm not sure if he got that one.
Right, and this isn't a vaccine that you get at school. Yeah. This is a vaccine that you get in your primary care provider. So typically kids get it between age 4 to 6 before they enter the primary years of school. They get a 10-year booster at age 15. But a lot of our kids did not get that booster or didn't get the primary completion series because of the interruption of COVID. So call your doc, your primary care provider, your nurse practitioner, whoever you see, and make sure that your pertussis vaccines are up to date.
And what about adults? When should they should they have gotten it?
Every pregnancy in the last trimester for women, and once as an adult. So typically if you're age 15 and then you're age 25, we'd give it to you again as once in an adult series. We really want to keep that herd immunity up. We really want to protect our most vulnerable kids under the age of 1.
Okay, absolutely. Always appreciate you joining us. Thank you very much. Dr. Marla Shapiro is our CTV medical expert.